Hello everyone, this is Serate, and I will do and demonstrate how to do the chain of survival. So first we'll do early access, so you need to call. Next is the early CPR, to do such thing, to revive a patient. And next is early defibrillation, correct the heart rhythm. And next is early advanced care, to really check the patient accurately. So thank you, and I hope you will enjoy my demonstration video.
So you're in a restaurant having a meal, and then suddenly you see a person having cardiac arrest. So you will do the chain of survival. So the first link in the chain of survival is the early access. You will need to call help first if you saw a person having a cardiac arrest at that moment. Early recognition to the health personnel is important in the chain of survival. The second link of the chain of survival is early CPR. You will need to do CPR if you saw a person lying down lifeless with no signs of breathing. So first check if the person has pulse. Next is to place both of your hands in the chest in this position. Next is to push fast 30 pushes and rescue breath if necessary. So the third link of the chain of survival is early defibrillation. By this method, you will use an automated external defibrillator or the AED. So first is to prepare the AED. So next, to place the electrode patches in the patient's lower rib. And next is to the right clavicle and to the right sternum. So this is the position. So before you turn on the AED, you have the first round of CPR by 30 pushes. So after you do the CPR, you will turn on the AED and correct the heart rhythm of the person by using the electrodes. And if it's done necessary, so you need to pull out safely and do the CPR if necessary and wait for the paramedics to come. So if you hear an ambulance coming, so this is the fourth and the last link to the chain of survival. So it is the early advanced care. So as you execute the second and third link of the chain of survival while waiting for the paramedics to come, the due is to really accurately check the condition of the patient by the paramedics as you recognize them in the first link. So basically, advanced life support and post-cardiac arrest care is the best left to the health professionals. So it may involve a multidisciplinary care team composed of cardiologists, physical therapists, and dietitians that provide life support before after hospital discharge. So this is the step that is often dependent upon the very first link in the chain, or the early recognition and the call for emergency and assistance.
And I will do the chain of survival. So first is early access. So you will call the medical staff upon its arrival because of a patient that is in need because of a cardiac arrest. Then second is early CPR. So we need to do CPR in 30 rounds to have the patient in need. And third is the early defibrillation. So you need to shock the patient upon its heart rhythm to be corrected. And the use of AED is very important for the chain of survival. So the next is the early advanced care. So why do we need an early advanced care in the chain of survival? It is to really accurately check the patient if it's okay, if the heartbeat is normal, and after the defibrillation, the patient needs to hospitalize after the execution of such. So thank you, that's all. And this is the chain of survival demonstration. and I hope you enjoy the video. Thank you.